Good afternoon, everybody. It's Tess Crawley here, clinical and forensic psychologist and director of Dr. Tess Crawley and Associates. Now, I'm coming to you live today straight into the Dr. Tess Crawley and Associates page, and I'm apologising yet again for not live streaming into the Stigma Rebellion today. Just a couple of technical hitches there. I'm sorry, guys. I promise to get back into live streaming into Stigma Rebellion. I hope to have that sorted out later on today. If you haven't joined the Stigma Rebellion yet, I really encourage you to do so. It is a closed Facebook group attached to this page, so it's linked to this page. It's if you search in Facebook for the Stigma Rebellion, you'll find it. It's a group. All you need to do is request to join, and I will approve your request. It's being a closed group, it means that it's a little bit more private. So the comments and the likes and the questions you ask within that group are only seen by other members of the group instead of your friends and family who are linked to you on Facebook. They won't be able to see that unless, of course, they're members of the group as well. So, it is an absolutely glorious, glorious day here in Hobart today, and I was going to film this vlog outside. It was such a sunny day, but just as I was about to press the go live button, my neighbour felt it necessary to start up his whippersnipper, so I'm glad he's enjoying some sunshine too, but it brings me back indoors, of course. Today I wanted to briefly touch on the topic of depression. Now, I've done a series of videos in the past talking about anxiety and how to manage symptoms of anxiety. We haven't talked about depression. Depression, like anxiety, is quite a large topic, so I will need to cover this in a number of different ways. But today I just wanted to give you the top 3 things to be looking for when we're talking about depression. I've mentioned in the past that it's really normal for everybody to experience the full range of human emotions. So we're not talking about a low mood that lasts a couple of hours or a day. We're not talking about a bad mood. We're talking about a persistent experience. Okay, so the 3 key things that we talk about when we're assessing depression are mood, which we call affect. Affect is just another way of saying mood. So we're looking at a low mood with a low affect. So affect means that your ability to switch moods depending on what's going on around you. You know how sometimes you can be in a really low mood and you pick up the phone, talk to a friend, and it just makes the world seem brighter and you can get back on with your day. If you're depressed, the low mood coupled with that flattened affect makes it really hard. Hi Kim, I can see you've joined this morning, welcome. So if you've got that flattened affect in conjunction with that low mood, then it makes it really hard for you to experience the ups and downs of emotions. You tend to sort of be stuck in that lower mood. Okay, so mood and affect, those 2 words go together. The other is cognition, so thinking. So if you're finding that this little inner voice of yours, those chattering monkeys, instead of with anxiety, those chattering monkeys will be talking about all the what ifs and catastrophizing and leading to fear. With depression, that can also happen, but the cognitions with depression are also quite what's the word I'm looking for here? They're really trying to drag you down. So, give up. What's the point? You're hopeless. No one likes you. You might as well stop right now. What's the point of it all? Those sorts of really negative, almost existential kind of comments that really just suck the life out of everything and can make you feel really depleted, can make you feel really hopeless, and also make you feel really helpless. So one of the key aspects to depressed thinking is, one is a sense of helplessness, so feeling that nobody has the power to help you out of how you're feeling, and a sense of hopelessness, that this will never change, that you'll feel like this forever no matter what anybody tries to do. So if you're hearing those sorts of thoughts or those sorts of attitudes pressing in on you in here, that's one sign of the cognitive aspects of depression. So so we've got the mood aspect on the affect, we've got the cognitive aspect, that's the second. The third key thing is energy. So that's the physiological component of depression. So feeling really lethargic, feeling like your sleep has been really affected in one direction or another. So either you can't sleep or you can't stop sleeping. Your appetite has been affected in one way or the other, so you're eating to compensate or you've completely lost your appetite. Your weight might have been impacted as a result of that, and you're generally feeling like you're walking through wet cement all the time. So that low energy. Now, not everybody with depression will have all three of those factors writ large. So some people might not have the cognitive component so much, but they certainly might have the low mood and the low energy levels. Or some people might not, so still might be feeling okay energy wise, but the cognitive and the affective or the mood component is really dragging them down. So looking at all three of those domains, we're looking at, the mood, is it low? Is the affect flat? So low mood that can't bounce up and down with positive influences in your day. That negative thinking, and that low energy, impacted energy level. So they're the three things that we look for when we're looking at depression. Now, the secret fourth factor is duration. So how long has this been going on for? A couple of days, or has it been going on for weeks? So typically we look at it, has it been for more than, or for most days than not, for the last couple of weeks or more. And certainly beyond that, we would be certainly concerned about you experiencing a depressive episode. Some people with depression have experienced depression before, so they recognise it straight away. Other people, it might be their very first experience of depression, so they're not sure, and they might be waiting, thinking, oh, I'm bound to get over this soon, or I'm bound to bounce back soon, and they're just finding that they're stuck. So if you're feeling stuck, or if you're recognising that you've got depression, it's a really good idea to go and have a chat with your GP. And your GP will have lots of suggestions for you. They might suggest some mobile phone apps. They might suggest the possibility of a trial of medication, and they might suggest going to see a psychologist. So we can talk a bit more in subsequent videos about those three elements. But today I just wanted to give you those three top things to look for when we're talking about depression. Other than that, if we can help in any way, please do feel free to send a message. I'm noticing in Facebook now that you can send your comment as a message. So if that's something that appeals to you when you're wanting to comment on these videos, go ahead and do that. You can contact us via our webpage, and I'm noticing an increasing number of people are doing that, contacting via the webpage. And all we get is your name, your mobile number, and your email address. So there's not, at this stage, there's not a section on that inquiry form to tell us a message. So when we get those, they come through to us as an email, just with your name, your phone number, and your mobile phone number and email address. So when we get those, we'll give you a call. So if it's not immediate, it might be that the admin staff in my office are busy with clients at the front desk, but they'll call you back, or they'll email you back, one or the other, as soon as they're able to. So that's a really good way of getting in touch. Another way is to ring us. You can ring our Hobart office. It's an easy number to remember, 03 6223 2122. Pardon me. Or of course, you can comment on these videos too. So don't forget, if you're interested in a more private interaction with these videos, jump on into the Stigma Rebellion. That's my little private Facebook group for people who want to be able to interact a little bit more privately. And also, if you're a psychology professional and if you are a board-approved supervisor of other psychologists, you might want to jump into my other closed Facebook group, which is Psychology Supervisors Australia. So you need to be a registered psychologist, you need to be approved by the psychology board to supervise other psychologists, or you need to be training to do this, you need to be doing the supervision training. So that's the other option for you there. Have a fantastic Saturday, and I look forward to talking to you all again tomorrow. Take care for today. Bye bye.